I think the state of the NHS is fairly healthy at present. There are things clearly that are wrong that have been well covered in the press. For example, huge pressures on the NHS, some failures in the quality of nursing care, people, particularly older people, being misplaced in the wrong sort of setting, some lack of integration between health and social care, and so on. But all of these, I think, are soluble problems. People, of course, are worried about the increasing demands on the health service. An ageing population they think will translate into an increased burden of care. I don't think that's necessarily the case. That the need to address the problems of chronic illness, yes, that is there. But I think all of these can be solved by two things. One is innovative working, and the other is appropriate levels of resource. There is, however, a very, very dark cloud that is hanging over the NHS, and that is the ideologically fueled vandalism that was implemented in the 2012 Health and Social Care Act, which has many, many worrying aspects. But the two that are most worrying are, first of all, that pretty well all NHS care will now have to be open to competition. Competition will lead to fragmentation, it'll lead to the wasting of resources, and in addition, it would appear the Secretary of State has distanced his responsibility from that of providing comprehensive health care. It's now merely promoting comprehensive health care. So I think there are very important political problems. But generally, so far, the institution is in reasonable nick. But there are challenges which will not be met unless we rescind these most recent political developments. Well, there are two scenarios. One is if the current Health and Social Care Bill is not rescinded, we shall have an NHS which is very similar to the American service, in which you get less care for more money. You will have skid row services for people uninsured. Many people who can't afford insurance will may be financially ruined, or indeed may suffer unnecessarily, or indeed die as a result of the inability to purchase health care. So that's one scenario. The other scenario is that the political class gets together and it recognizes that the current ideologically driven commitment to private care and to the disintegration of the NHS can be reversed. And if that happens, I think the NHS could be in rude health in 10 years' time. It will require a collective discussion about how much of our resources we're willing to commit to the NHS. And I think if that discussion was honest and transparent, people would be willing to contribute more to supporting their own health and the health of their fellow citizens. I think they need to do three things. One is we need to we need to repeal some aspects of the Health and Social Care Act of 2012, and I've mentioned some of those already. Secondly, they need to open up a totally honest debate about the problems and the achievements of the NHS. And thirdly, I think there needs to be honesty about the resources that the NHS requires, and to say to the electorate, look, what do you want? Do you want services that will deteriorate because of insufficient resources, or are we all in this together, and can we commit ourselves perhaps to higher taxes to fund increased healthcare that we all of us want? I think the risks probably come from poor diagnosis of the problems. I mean, as a doctor, I always think that you should identify the problems. You should then, on the basis of your diagnosis, propose a management plan. And I think that this kind of rational approach to problems within the health service is actually quite difficult to put forward within the current political debate. And also I think the media, in many respects, are at fault. Certain sectors of the media are actually opposed to the health service. They don't like the idea of a publicly funded, public provided service, free at the point of need. And they will pounce on things, some things that are important and other things that are less important. So I think we have great risks in irrational responses to genuine problems. I think that's our biggest risk.